Okay, John and Paul have been giving you a little personal experience. I'll just give you a little personal experience from my side. You have to be very careful, as I was saying earlier, about whether a drug's covered with formulary or not. My wife is on a medication, and the cost of that medication retail is over $125,000 a year. Whoa. And she's been on this medication, or this type of medication, since the 1990s, every year. So this is a maintenance drug. If this applies to anyone in the audience, either on the webinar or in the house here, come to see me. There are additional programs over and above what Medicare Part D has for people in that fairly unique situation. My wife has MS, which is not, about 1 million people in the country have it. So if you've got a certain type of illness, which, as John was saying, for cancer or for a lot of other illnesses and maladies, and you have a very expensive medication, come to see me and we can talk. Okay. So that's kind of the overview we've got for all the different pieces of Medicare that impact us as employees as we move off of Chrysler or Stellantis insurance. So Stellantis, when you turn age 65, on the first day of the month you turn age 65, you or your spouse will cancel your medical coverage. And that includes your health insurance, your dental, and your optical insurance. You will lose that. Your spouse won't until they turn 65, but each person who, when they turn 65, that insurance gets pulled. But what they do is they do give you some additional benefits, or benefit. And I'll explain this now, and it's kind of going to what Dario was saying a little bit earlier in the presentation. So we're going to talk about right now these are unique Chrysler, Stellantis type of things. Everything else we've been talking about so far has been generic for anyone in the United States. But now we're going to go into the weeds a little bit with specifically for things related to Stellantis.
Do you have a pass out on that?
Pardon?
You have a pass out on that, right?
Yes, yeah, well, there are some pass outs on the table that we'll have for you. I think there are 4. We'll talk about that at the end of the whole presentation. So what we're going to talk about is something that's new for someone turning age 65, which is called a healthcare retirement account, or HRA. There is also something called a RHCA RICA. We'll tell you about how to set things up on a website called Wageworks, and some other details related to this. So let's see, does the pointer point? Hey, all right. Whoop, go back. There we go. Okay, so when you turn age 65, FCA will set up an account for you called an RHCA, a Retirement Healthcare Account, or RHA, or HRA, excuse me. And from that, you will receive an amount of money up to $1,975 for a retiree or surviving spouse, and up to $1,750 for a spouse if you're still married, if you still are a couple. It says up to, I'm sorry?
Is there an age on its spouse?
No.
The spouse would be 65 or older.
Oh, 60, yes.
But we've also lost FCA coverage.
Correct. So it's only when you lose the coverage. Good point.
I'm coming over for a question.
Now this money, is this the original spouse you're married to when you retired? Or if you get remarried again, does your second spouse get that money?
No.
I think it's the spouse upon who you were married to at the time that you retired.
I know, not think. Yes.
There you
Not
go.
from personal experience, thanks. We've been married 53 years. But I know the rules. And remarriage or marriage after retirement that doesn't warrant the spousal amount of the HRA.
Rich was one of the high executives in the HR department at Stellantis Daimler Chrysler, et cetera, so he knows what he's talking about.
You can throw your pens and rocks at me or anything else. And in the early 90s is when we installed Retiree Choice, and then the Retiree Health Care Account, and Flex Plans sort of for retirees. That was part of that.
So, it says here up to, and what that means is the absolute number of 1975, let's say, for retiree. First of all, that number hasn't changed in many, 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 many years, which is a problem and something that NCRO, thank you, has been working on with the HR department in Auburn Hills for many years to try to get that inflation adjusted, but it has not been. But the up to relates to if you're getting a pension, you know that depending upon when you retired, you either got 100% of your pension eligibility or you got a percentage less if you early retired. So that same percentage is then applied not only to your pension, but also to your HRA account. Okay? So that's nothing new. It's what when you retired, that percentage will now be used in a second place.
Howard, if I could?
Yes, sir.
It's actually age service related. If one were to retire early at age 60 with 30 years, that's still 100% of the $1,975. So it lower service and younger age will bring that $1,975 down.
And you can find out what that percentage is if you don't remember it. It should be on some documentation you have at home, or else you can go on the Benefit Connect website, and I think it's also there. Am I right?
I'm not sure, but each year a statement is provided as to your, I'm talking about those of us over 65. Each year we are reminded of our, whatever they call it, age service percentage, I think is the word. But there's a question here.
Turning 65 in May, would that be a percentage of that, or will they not give that to me until October of next year?
Well, the amount of money on the 1975 is prorated for the first year. You'll get X number of months for the rest of the year, and then it'll be 100% for the going on in the future. Exactly. You'll get, exactly. 7/12, so it's 7/12 times the age service subsidy times 1975. Okay.
We made it as complex as we could.
So, what can you use this money for? Well, you can use it for medical and drug insurance premiums, deductibles, co-pays, or co-insurance, or other healthcare coverage expenses, dental, vision, hearing, etc. If you ever had, when you were working, something called a flexible spending account, it's very similar. The rules are sort of similar. You can put the insurance premiums against it. When you had a flexible spending plan, you couldn't. It could only for your out-of-pocket money. But these HRAs, you can also put your insurance premiums. But it's the process of getting it authorized and getting the reimbursement is pretty similar. Now, there was a change a number of years ago in 2016, which makes it a little bit different than a flexible spending account. Flexible spending account was use it or lose it. You put a certain amount of money in the account, you use it during the year, and if you don't use it by December 31st or a few months into the next year, the money goes away. For these, two rules are different. Number one is the money carries forward year over year. So if you don't use it by chance all in this calendar year, the money will be available in next year for use. But on the flip side, if you have more expenses, because again, 1975 doesn't go very far these days, as John was kind of going through the premiums. So if you spend more than the 1975, the website, and I'll tell you about Wageworks in a second, but the website keeps track of that. If you submit the claims, if the claims are here and you only got 1975 there, it will keep track of that money that you didn't get reimbursed. And then when the money gets re-upped in January for another 1975, but bump, you get a check. Make sense? So again, different than a flexible spending account where one, it's not use it or lose it, and number two, if you have claims over, it will keep track of that and will give you the money. It just won't give it to you this year, it'll give it in subsequent years when the money gets set up from Stellantis. We'll fund it in the Wageworks account, which we'll talk about in a second. So, again, what are the eligible expenses? Well, it's for any insurance premiums, office visits, prescription drugs, whether out-of-pocket or premiums, some or most OTC, over-the-counter medications, medical supplies. You can't use things such as cosmetic procedures or some over-the-counter products, general toothbrushes and dental floss and hand lotion. But
Long-term care premiums is a good one.
long-term care premiums, you can put against it, John? Can. Okay, so long-term care premiums you can. But very important note is, I skipped over it intentionally, where it says important note. And I think Dario brought this up a few minutes ago. You can electronically have your Part B premiums, Medicare Part B premiums, reimbursed monthly through Wageworks automatically. So what happens is this company called Wageworks that Stellantis has contracted for to help coordinate all this paperwork between the money coming in and the money going out. They have a linkage to CMS, the Center for Medicare and Medicaid in Washington, D.C. They get a feed every month of, if you're on Medicare, that you're on Part B. They get a little indicator saying, yep, John is paying Part B premiums. If you check the right box on the Wageworks website, they will automatically put that claim of $148.50 this year? $148.50 for this year. They will automatically put that against your account and then send you the check. Oh, by the way, you can set up a bank account so that the money electronically gets transferred to your bank account out of the Wageworks account. But in this way, you can do it untouched by human hands. If you check the box, automatically, every month like clockwork, when they get that tape saying that the Medicare premium has been paid, boom, you get a check or a deposit in your checking account for that $148.50. Okay?
As long as you have that much money left.
If you don't, it'll accumulate. It'll say, okay, $148.50 times 2, times 3, times 4, and then in January, when the money comes in again, boom, you get a big check in January. So this saves a whole bunch of paperwork, because otherwise you're filling out claims forms. I went to the dentist for this, I got a pair of glasses, I did this kind of a copay, and you got to enumerate all of them and give them a whole bunch of proof. This way, it's all done very, very easily. So, we got a question over there. Just a second, Bob.
So, Hop, just to check my understanding, so 148.50 times 12 is about a little less than $1,800. So really, it's almost perfect. I mean, they give us $1,950 and they send us back almost $1,800. Do I got it right?
There's only $169 left, and next year they are going up by $10.
Mike, please.
You'll probably keep the whole thing. The automatic is the way to go. Right.
Yeah, so John just said that, what Bob said is absolutely correct, that the amount of the Medicare Part B premium is a little bit below, but very close to how much money FCA or Stellantis gives you. So therefore, there'll be very, very little left at the end of the year if you go on with that automated process. Just as I was saying earlier, because that Part B premium has been increasing year over year, and Stellantis has not been changing that amount. Those two numbers have been climbing, getting closer and closer and closer. That's why we've been lobbying with Auburn Hills to try to be a little bit, more generous with their benefit, but they have not decided to do that. So that is a new benefit that you get after turning age 65. But Dario also said earlier, but what about the money that we were putting away all the way through while we were working? Well, that is called the Retirement Health Care Account, RHCA, or RHCA. And that was money that you had set up and had been donating to either after tax, or there were some corporate contributions and matching that were going into that. Those monies are kept in the same place as your 401k, which is with Bank of America or Merrill Lynch, and then with some mergers, it's now Bank of America Merrill Lynch. So if you so chose, and if you have a RHCA account, then that money is there, and you can use Wageworks to go through the same process to kill money for your out-of-pocket expenses or insurance premiums and put it against your RHCA, because that RHCA can only be used for these kind of expenditures. Your 401k, obviously, you can use it for whatever you want, but the RHCA must only be used for medical expenses and can only be withdrawn based upon going through Wageworks. Question over there.
What happens with our HSA?
HSA is it's another set of pot of money that you can use. That is regulated by the IRS, and an HSA can be used for these kind of expenses. The big caveat with HSA is once you turn age 65 and you go on Medicare, it is illegal for you to add more money to HSA. But you can, all the way through, after age 65, you can withdraw money based upon a reimbursement process. But that's covered through a different bank, and that's not something we're talking about today.
That's a different filing that you do for out-of-pocket expenses.
And that's going through, I think, Bank of America.
My RHCA account, can I pay for my wife's medical expenses with my RHCA account?
Yes.
And in that case, regardless of age, so that your wife would be 47, and you can do it.
And the same thing for your HRA. Once any of you have an HRA, you can use expenses from either of you.
Sorry, Howard, I got two comments.
Yeah.
If you signed up for the automatic pay, the $148.50, but you're paying because of a surcharge, a higher amount, you got to file for that.
Mm-hmm.
They aren't going to guess how much you're paying in total. They only know the $148.50.
Correct.
The other thing is, if you want to take that money out of your RHCA, you got to turn off the automatic pay, because once it's going to pay from there, and when it runs out, it's going to accumulate for the next year. But if you want to use RHCA because you want the money quicker, then you got to turn off the auto pay. So,
Yeah, just.
Couple
just-
little tricks.
Just to clarify that a little further. If you're paying the surcharge so that your Part B premium for the year exceeds that 1975 by quite a bit, my recommendation is, you turn off the automatic, because it gets confusing, because then you have to figure out how much they paid automatic and then pay what's the difference from your RHCA. So I went through it and I set it up so that I was paying all of it out of my RHCA, because you can actually file for the whole year. You take your Part B premium times 12, and you put in a single claim in January. You put in the time frame January 1st to December 31st, put in the total amount. You say, take it from my RHA and then take it from my RHCA. You only file once, and every month they'll send you that total amount. They'll just take the money, send it, divide it by 12, send it to you.
Now, to take an already complicated situation that we've just gone through and make it a little trickier. For a RHCA, you're coordinating two websites. You've got Wageworks that you're actually submitting the claim through, and then you've got Bank of America Merrill Lynch where the money is sitting. Wageworks has no visibility to Bank of America Merrill Lynch. They cannot see how much money you've got there. So the arrangement is that you, as an individual, need to call or go on the website of Merrill Lynch and say, please take money that I might have in a mutual fund or in a stock or whatever. I need to sell that, and I need to transfer that money to the RHCA Institutional Money Market Portfolio 2, or the institutional fund. So you need to transfer that money on the Bank of America, on the Merrill Lynch side, and then put in your claim through Wageworks. Because if you don't do that, and you put the claim in, Wageworks will put the claim in, it'll get rejected because the money won't be in the right bucket. It'll be pending. All right, so it'll be pending. So they won't just drop it on the floor, they actually will, and if you do the transfer, then it'll go through? Okay, I didn't know that. I thought they would actually reject it.
They used to. I think that has changed.
Okay. So there's a lot of financial manipulation you've got to do on this to make it all work correctly. Another little twist in this is you can also, if you're between age 55 and 65 and you're still on Chrysler insurance even though you're retired, you have the option to pay your insurance premiums through the insurance premiums you pay to keep Chrysler insurance. You have the option to pay that out of your RHCA. But what happens with that is when you sign up for your annual benefits in the fall, you have to pre-fund that. So you have to take the premiums and put it into this institutional account, and then Bank of America or Merrill Lynch will take that and put into another category called a frozen account. And you can't touch that for a year. That guarantees that Stellantis is going to get their premiums every single month for 12 months. So it doesn't impact a lot of people, but if you are between 55 and 65 and you are paying for your health insurance premiums of Stellantis through your RHCA, there's another step. That extra step happens through Bank of America. I think they do that automatically. So you can see how tricky and complicated this can get depending upon what options you have. So let's see. So it's frozen, the balance of the RHCA. Oh, so anything that is not frozen is available to pay any of these costs, but it has to be transferred to that institutional account. Here are the websites for Merrill Lynch and a telephone number, and you can work any of the details out with them. So what will happen is when you turn 65, you will get a communication from either Stellantis or Benefit Connect, who is like the HR department for Stellantis. They've outsourced that. And you'll get a letter saying you now have money available or will have money available through Wageworks, but you have to set up an account. So you would go online to Wageworks. They will ask you a whole bunch of questions to identify you, and that will actually set up this account. It only can work once you physically turn age 65. So you've been hearing about doing things 3 months, 6 months ahead of time. For this, you actually have to wait for the communication you get from Stellantis or from Benefit Connect, and then you'll actually go onto the Wageworks account. There's the URL for that. It's also on your agenda, and it'll be in these presentations, and you go through these steps and you'll create an account. Once your spouse also turns 65, you'll have one account through Wageworks. That's a combination of both of those funds, both yours and your spouse's. So you don't end up with a spouse account and your account. You end up with one account. That's the sum of the two. Going through the website is the fastest and the easiest, but if you're not as computer literate, there are paper forms that you can fill out to send to them either by snail mail or faxing. It will take longer and it's more laborious, but it is available if you're not comfortable using computers. On the NCRO website, ncro.org, and again, our page is Medicare Social Security at the top of the page. All this information related to RHCA and HRA is all there. All the forms are there. There's a quick start guide. There is lots of documentation to assist. What we have not talked about in this presentation here is actually how to file a claim. That's a little bit more complicated. So all we're telling you is about the process of getting money in. And it'll be up to, on our website, we have a whole process of how to get the money out. But for right now, this is getting the money into your account and just giving you familiarity with the whole process. And then also on our website, ncro.org, is a whole bunch of additional information related to a lot of these presentations, information about Benefit Connect, information from Medicare and Social Security. We'll talk about a little bit mailings you might be getting from FCA, or now we need to change that to Stellantis. That mailings you might be getting from another one of the consultants, et cetera. So we have got the insurance committee has tried to gather all the information you might need. All the information you might need to make sure that this makes it as easy as possible. And also, we have on your agenda, you will see there's an email address for the insurance committee. So anything that you're not able to resolve, either through these presentations or through talking to Benefit Connect or Wageworks, that's why we're here. We're here to help. And it's inscom@ncro.org, and you can send us an email, and we troubleshoot these kind of things. The only caveat with that is we know nothing about you. We have no access to your personnel records, your pension records, your benefits. We're at 40,000 foot. So we can help diagnose some problems, and we can also interface with people in Auburn Hills. But if there are specific questions that only your personnel manager would know about you or your personnel records, we don't have access to that, but the people in Auburn Hills do. So we can play middleman between you and them. So here's a whole bunch of contact information. Merrill Lynch, Wageworks. Also, Wageworks got purchased about a year ago or merged, so now they're called Health Equity Wageworks. There's our email address and then Benefit Connect at the top. Okay, any questions that we didn't handle on that piece? Good. All right.